face the Filipino-American Community Empowerment. We also have, where's the other one? Loretta. I thought you were sitting there. Loretta, and she's a project director of the neighborhood health care. And of course, one of our newest members is Yasmin. We already recruited her. Okay, and we have two others, but they're not here. I would like to also say that Paul Valen was a former board member of KCS. We have a volunteer here for KCS, Veronica. She's the one who takes care of our Facebook. You know, so we are actually on Facebook, and she's the one who does all that. So is there anybody? I also have some former students here. Of course, I have Sian Tanko. He just was in my class last semester, and I have Nikki. Nikki was my former student many years ago. I don't remember her, but she remembers me. So today I would like to talk a little bit about Kalusugan Community Services. And of course we are an older organization. Can you do it so that they all come at the same time?
Oh yeah.
Erwin?
I don't know how to do it. Yeah, I got it.
There we go.
Okay, so I'm going to talk a little bit about KCS, our past, our history, and some of our current activities, and also our future directions.
Yeah, see it?
There goes.
As I mentioned, we are a little bit older, so we were founded actually in 1992 as a coalition. We have a coalition called Project Kalusugan, and it is made up of 3 organizations. We have SDSU, represented from the Department of History with Dr. Wades, and I'm in the School of Public Health. We also have COPAW and Operation Samahan. So we stayed together, so we formed Kalusugan in the beginning. Okay. What we did as a coalition was we conducted a health needs assessment of the Filipino-American in San Diego. So that was in 1995, so that was a long time ago. And these are the major problems that we found in the Filipino population: cancer, heart disease, stroke, diabetes, and mental health. And it's not really surprising, but now, 2013, we still have the same problem. These are still the main problems of Filipino-Americans here in San Diego. Okay. Now, what happened after the 1 year of our coalition? We decided we really worked very well together. But then after that 1 year coalition, we all decided to go on our own. Okay, the SDSU part became KCS, or Kalusugan Community Services. COPA went on their own. Operation Samahan went on their own. That was really, that was not what would have happened if we really stuck together during these 20 years. I'm sure that we have done more if we did it together, but we tried to do it all separately because of conflict of interest, of our own interests. But now we're getting together again. After so many years, 20 years, we decided that, we should really collaborate. Okay, so our office was in SDSU for a while because we were teaching there, the founders, me and Dr. Wades. And so in 2002, we opened this center. We got grants from the private foundation and from the community, so we were able to build this center. And of course, our mission is really to integrate most of the health problems in the community, so they will be one. Because as you can see, even now, there's so many things. So our mission was really to integrate all these health problems. And we have been successful. This center was built in 2002. It's now 2013. So we really have developed really a comprehensive. We know now, the different organizations, that are working together, related to health. Okay, so after all these years, we have come up with a mission. And our mission has not really changed very much. Our mission is to improve the health and well-being of Filipino Americans. We added other underserved groups. So now we're reaching out to Asian Americans, like the Lao, the Cambodians, so it's not all Filipinos. And we do this by promotion of positive changes in lifestyle. And we have added, and the environment. Because, even if people know what to eat or how to live healthy, if their environment does not support what they are doing, then it's not very, very successful. So we also go out to the community, and I'll let you know about some of the projects we have in the community. Okay, so there are really 4 components of our program: community services, advocacy, research, and training. Our biggest program is community services, and we disseminate a lot of health information. We do it through our handouts here, to our website, through the ethnic media, because I write for the Asian Journal. We participate in a lot of health fairs, now email, and also the social media, and we do it by personal contact. Okay, these are some of the cultural fairs that we participate in. And this is just an example. The Film Fest is also, we are a fiscal sponsor for Film Fest right now, like CAMP. CAMP is right now our other fiscal sponsor. Okay. Okay, we do screening and referral. Before one gets high blood pressure or cancer and diabetes, they have to go through screening. So we do that usually with the Philippine Nurses Association and the Lions Club and the other organizations like Operation Samhan. Okay, we also do community workshops like how to track your high blood pressure with the American Heart Association. We form a Filipino forum, which is really to get ideas from the community about the issues of the Filipinos. We also now, for the first time, we are now a facility that does workshop on the food handlers workshop. So we thank Dina for that because of her expertise in the environmental health. If you are an owner of a restaurant, or want to have a certificate, then you have to go through a process, to a training period, maybe just for a half day, and then we can give you a certificate that you know how to make the food safe and sure. We do workshops on depression. That was the last workshop that we did. Okay, this is just part of the Filipino Forum that we did last year. One of the things we do, we really is do workshops on healthy eating. So we do food demonstrations, and the people can get to sample some of the healthy food. We do physical activity as a component of healthy eating, like aerobics and things like that. Okay, I will just want to talk about 3 programs that we did for this year. Okay, the first one is we are part of the Alliance of Filipino American Community Health Workers. Okay, because there are more need now for health workers. One of the things that the federal government is doing is to train community health workers. And that's what we did last year. We trained about 6 community health workers to to do a workshop on how to reduce the risk for heart disease. And this is a federal grant, you know. So this is our first time to really get federal funding from the NHLBI through the Kalusugan Coalition in New York. Okay, so they have a very good curriculum because everything they already prepared the curriculum. There are 10 sessions. They already know, everything is all lined up, how to prepare it. They have handouts to be given out. They have flip charts. So we did this year to maybe 4 senior citizen centers. We first trained the community health workers, and then they did these sessions in 4 senior centers. And so we are just coming up with some of the outcomes, the results, and we found that there was really a change, of course, in knowledge as a result. People know what is it they want to do, but we didn't find a very significant outcome in terms of changing their behavior. Okay, well, it takes a while to change behavior, so you can just do it maybe in 2 weeks or 2 months, So it needs more change. Okay. The next project we had last year, and it's still ongoing, is Strive, and that is what Strive stands for. It's also a federally funded program. So we got funds from them, and it's administered. We're doing it in collaboration with Operation Samahan. Okay. And what we do, we work with restaurants. This is, I mentioned about working with the environment, because you know what to eat, but you go out to the restaurant and you have all these fatty, salty foods that you look at, and it's not really helping you. So what we're doing is working with these restaurants, and so that they would prepare food that are healthier, which is lower in fat, cholesterol, salt, and sugar. And then we ask the chef to prepare that. In fact, I think the Filipino bakery, restaurant and bakery is part of this our project, in which we modify their mongo guisado to be healthy. So please go to the restaurant and try out the healthy mongo guisado that we have done. So we have, this is where we have expanded, not only with Filipinos, but we also work with Laotian restaurant, with Vietnamese restaurant, Thai, and also a Pacific Islander, Hawaiian and Chamorros. So we have worked, we have now 13 restaurants that we work with regards to this project. We're going to have a conference about this about this project on April the 2nd at the Operation Samahan. So you're welcome to come. We don't have the flyers because we changed the date, but maybe we will send some to Lily, because she might want to participate, being a part of this project. Next. Okay, we do workshops, and one of the successful workshops we had was depression across the lifespan. This is, I'd say, the 3rd mental health workshop that we have done. As I mentioned, we have a comprehensive view of wellness. When we say wellness, we don't only mean physical, but we also mean mental, social, emotional, financial, and spiritual. So we cover all those. So all our workshops are really geared to all those components. And it was sponsored also by a lot of other groups. Okay, one of the strongest program we have is the volunteer program, because our grants have dwindled so low. We cannot afford to really hire full-time staff or even part-time staff. So we have to depend on many volunteers. So we have volunteers, but we really formalized it in 2012. So we have a recruitment every year. We train them, give them assignments, recognize them during the annual anniversary. So one of our need is a volunteer coordinator. I think Paul was that person for a while, but he left.
Sorry.
and he went to the domestic workers program, so now we don't have a coordinator. Okay. So if any would like to volunteer, it's open. Okay. Okay, I'd like just to highlight the importance of volunteers, that they are, I think most of you have volunteered. They have an obvious strong personal interest in the work. They don't ask to be paid. Often they become the most committed board members, and in large measure, they become significant future financial donors. So let's build a program that identifies their interests and expertise, gives them consistent, respectable work, develops and recognizes and rewards them, and honor their service. Okay. So I mentioned already that for this year, we will continue the project Strive project. Then the second is we also are now an entity, the Covered California Entity Program, and some of us just finished the training to be a counselor. So as you are aware, March 31st is the deadline. So if you still don't have, because young people are the group, one of the largest groups that don't have any health insurance. Okay? So we have one that's certified already, Mr. Art Chodosha. So make an appointment for him, please, if you want to be enrolled with the Covered California. Okay? Because, there's a deadline, March 31st. And pretty soon, you would be able to come to me also and our other things. And then the most important, of course, that we're doing this year is to restructure our organization. And we're going to have a strategic planning. We just have recruited new board members. We will have new methods of operation after our planning. Because this is our 21st year. So we're kind of, when we started this, that was 21 years ago. And now it's 2014 and things have changed. Trends in the economy, in the way things go, change. And so we have to change as an organization also. So that's what we're trying to be doing, was to change what direction. What should our vision be? Should it be the same? Should it be the same mission? How about our objectives? How about our activities? So we have to change that too. So that is what we will be concentrating mostly this year. Okay. Okay, so in terms of needs, these are what we need. We need to have some funding, extra funding. So thank you for Route 54. To help us with our needs to support programs, because our programs are only available it's limited by the funds that we have. If we have the full capacity, like we used to with all the grants that we have, we can do a lot of programs. But if you don't have very much funding, then you can only do so much, right? So that's the bottom line of everything. If you don't have any funds, you do just the basic. We need volunteers who are dedicated, to helping our activities. We need talented and creative board members, so to move the organization, and we need to collaborate more, with each other. So with that, I'd like to thank some of our funders for this year. The SDG&E is a very strong funder of KCS. Also, we have now added Route 54 to our list. We have lots of individual donors also. but we still also continue to write grants. Although, you know, it has dried up a little bit from the government level, but there's still a private foundation that we can write to. And of course, we welcome in-kind contributions from Bread Deluxe. We're from Yasmin's mom. Manila Sunset is a frequent donor with us, and we have a lot of raffle donors. So I really truly appreciate your presence and your coming here, and specifically, you know, to the Route 54 that is now one of our funders. Thank you very much.